If you've ever been told that you had a biochemical pregnancy or a blighted ovum or an anembryonic pregnancy, that means you were pregnant and you had a miscarriage. I'm Dr. Lucky Seekon, a double board certified OBGYN and a reproductive endocrinologist and infertility expert. And I want to break down the different terms that are often used to describe very early first trimester miscarriages. A biochemical pregnancy is an early pregnancy that stops growing before 5 weeks. So the only sign that you're pregnant is a positive HCG level, whether that's detected in urine or on blood work, followed by subsequent negative tests. So it's basically the earliest form of a miscarriage because it occurs before the embryo had a chance to implant long enough to actually be seen on ultrasound. A blighted ovum is an early first trimester miscarriage that occurs a little bit later than a biochemical pregnancy loss, in that you have the positive HCG level and you can start to detect the pregnancy on very early ultrasounds, but it doesn't get very far. So usually what this means is you see an empty gestational sac. It just looks like a big black circle and there are no structures inside. Normally you would see a yolk sac, and then a week or two later you would start to see the fetal pull and maybe even the flicker of a heartbeat. The terms blighted ovum and anembryonic, meaning no embryo, pregnancy, are often used interchangeably. And this is a big pet peeve of mine. There's a lot of misinformation about what a blighted ovum truly is. Even when you look at reputable websites, they'll define it as when a fertilized egg attaches to the wall of the uterine cavity and it doesn't become an embryo. But that's impossible because we know that an egg is fertilized in the fallopian tube and takes a few days, almost a week, to travel to the uterus. And by that point, it's most certainly a blastocyst stage embryo that is then capable of hatching from its shell that it inherited from the egg, and then it attaches and implants in the uterine cavity. So it's impossible that the definition, a fertilized egg that doesn't turn into an embryo, can be correct. It's actually an embryo that didn't turn into a fetus. Words matter, terminology matters. For someone who has experienced this, they know that it's devastating. They know that it's a miscarriage. But it often feels like people get caught up in these definitions and semantics, and it can lead to this gatekeeping of support for people who are going through pregnancy loss. And it's important for me as a fertility expert to say out loud that whether you have an early first trimester loss or whether it happens after there's a heartbeat, it is painful, it is a pregnancy loss, and it is valid.